Hey guys, Dr. Ware checking in from Laveen Veterinary Center. So a lot of times people wonder what the benefits of a kind of annual physical exam or physical consultation are, and it does provide a lot of information. Initially when we come in, we kind of take our vitals just like we have done when we go to the doctor. Also, and very important is, we kind of do the subjective part. We talk to the owners, we see how the patient is doing, we see how their appetite is, how they're behaving, if there's any problems that the owner is concerned about. So a lot of information can be obtained from this. And we're big on preventative medicine so that our pets can live long, healthy lives, and we can keep them around as long as we can because they're our heart and soul. So we do the best we can on our part. But the other part is actually the medical physical examination. And you can really obtain a lot of information from these kind of just routine exams. And I'm pretty systematic in my approach to it, so I figured, hey, what better way to kind of see a nice, thorough physical exam than being in the room here with us. So we have Salty here, who's been on our site before. He's a celebrity. So he's a Labrador Retriever that we've been seeing for a long time. He's a great patient of ours. And so we'll just go through our routine physical exam and kind of talk through every aspect of it, okay? So, like I said, I'm pretty systematic. I always kind of start with the head end and I work my way back to the tail end. So I like to start with the eyes, the mouth, the ears, and go through each one of them. So with Salty, we'll have him sit down. So like I said, the first part we'll start with the eyes. We'll kind of determine his response to light. And a lot of times when I come in to the room, I'm not just chatting, but I'm also observing. Now I'm seeing how they kind of normally act. Hang on, Salt. I'm seeing how they normally act. I'm watching how they walk around. I'm making sure their mobility is correct, but also assessing them neurologically, seeing if they're behaving properly, seeing if they have any discomfort. So the second part of the exam is I'm checking out his ears. Labradors are known for having ear infections because we all know they love to swim. Sometimes they have allergies, and sometimes they have these kind of low-grade ear infections where we got to clean out their ears or kind of do some ear maintenance. Salty's look pretty good. But we'll take our scope and we'll look down at the eardrum. Make sure it looks healthy. Beautiful. Excellent. He's a very compliant patient. They're not all like this. Ear canals and eardrums look beautiful. Yeah, so. Okay, next part, we'll check out his chompers. So you can see nice big canines, a little bit of tartar on that canine tooth, but no gingivitis. All the way back. So we can see Salty probably due for a prophylactic dental cleaning sometime in the near future here. Little tartar on the back, premolar, but no gingivitis. Okay, now you gotta say ah. Oh yes, that's not fun. Nobody likes that. So as a veterinarian, you gotta be pretty mobile. A lot of times we're on our feet, we're on our knees, kind of manipulating things. So you gotta be willing to work with the patient. So next, we'll go ahead and feel his lymph nodes right underneath his jaw. They feel normal sized. Feel the lymph nodes by his shoulder blades. Perfect. Okay. We'll give him a little breather for a second. Let him walk it off. All right. Okay. So secondly, here you go, Kayla. We'll feel for any lumps or bumps. Check the underside of his paw. Beautiful. Okay, feel for any other lumps or bumps. Okay, next, I'll go ahead and I'll palpate his abdomen. Make sure that he's not painful or uncomfortable inside his abdomen at all. Make sure that I'm not feeling any masses or irregularities, which of course I'm not. Perfect, Salty. Okay. We'll move on to our back legs. Feel the back lymph nodes. Back lymph nodes feel good. Back paws feel good. We'll check out the business end. Okay. We'll take a listen to his heart and lungs, make sure that we're not hearing any murmurs, arrhythmias, make sure that in the lungs every field sounds normal. If you could hold his mouth closed for a second. Okay, so his heart and lungs sound perfect. So, his physical exam was great. You know, Salty is 7 years old, so we're going to run some blood. We'll do a screening blood work panel, check, make sure cell counts look normal, check his liver and kidneys, blood proteins, blood sugars, electrolytes, make sure everything looks okay, do a heart rate test, and then update his vaccine. So he'll get a nice thorough physical exam. Thanks again for checking in.
Bye, Salty.